Hello, YouTube viewers. I am Dr. Tahir. Welcome back to Youthful Medicine. Time to time, I also see patients and take care of their urgent care needs or primary care needs. And I'm going to discuss with you a case that I saw a 35 years old female who was concerned about having a yeast infection. She has vaginal itching and discharge, and these symptoms have been going on for about 5 days. She recently had a course of an antibiotic, and she was not sure if she has a yeast infection or again a repeated UTI infection. So I will talk to you a little bit about what these symptoms are, what is the differential diagnosis of this presentation. So yeast infections, also known as vaginal candidiasis, they are common and can cause a variety of symptoms. And the typical symptoms and the differential diagnosis for this concern includes vaginal itching and irritation, thick white cottage cheese-like discharge is seen in yeast infection. There is redness and swelling of the vulva, burning sensation, especially during intercourse or urination, and soreness and rash. The differential diagnosis that can be in a case like this is bacterial vaginosis, which is symptoms of bacterial vaginosis are slightly different than candidiasis or yeast infection, which is essentially means fungal infection. The symptoms are there's a thin grayish white discharge with a fishy odor, especially after intercourse. Vaginal itching, irritation are less common. Diagnosis usually is made by microscopic examination of vaginal discharge, pH testing, and a test called whiff test, which is release of fishy odor on adding KOH or potassium hydroxide. Now, these tests are done when we are not sure if what's the diagnosis is. Mostly we treat empirically. There's another infection called trichomoniasis. Trichomoniasis is a infection which is also transmitted through partners, and it causes frothy yellow-green discharge with a strong odor, vaginal itching, discomfort during urination, and during intercourse. There's also possible redness and swelling. The examination also involves some microscopic examination of the vaginal discharge, and they do a test called NAATS, which is either a rapid antigen test or a nucleic acid amplification testing. And other possible conditions that can happen is contact dermatitis, where there's a reaction to soaps that comes up a lot, many times, detergents, fabric softeners, and they cause itching and irritation. Sometimes there are possibilities of an underlying sexually transmitted infection, such as herpes or chlamydia, which can cause similar symptoms, but often cause soreness, sores, or other systemic symptoms. So treatment is based on your cause. So in this case of yeast infection, I prescribed her an oral fluconazole treatment, which is diflucan. It's commonly used, and we usually treat with one dose and repeat it after 72 hours. And for treatment of bacterial vaginosis, we either use an antibiotic called metronidazole or clindamycin, which can be administered either orally or through intravaginally through cream. And typical course is about 7 days. For trichomoniasis, antibiotics like metronidazole or tinidazole are usually given as a single dose, and it is important to treat your sexual partners as well because it is transmitted through sexual encounter. So overall, the discharge characteristics can help us differentiate between either it's fungal infection, bacterial vaginosis, or an STD-related trichomoniasis. But I usually tell patients odor, smell also can differentiate in bacterial vaginosis and trichomoniasis. They often produce noticeable odor, which while the yeast infection typically does not have that smell. Response to treatment can also help you differentiate what it is. So I usually encourage my patients to avoid um, use of products which are put intravaginally using unscented hygiene products, because these chemicals in these products can lead to disruption of your normal vaginal flora. Wearing loose-fitting, breathable underwears when you are dealing with the infection is important, and also using probiotics. Healthy diet is important. Probiotics can help counterbalance and imbalance of your counteract against the imbalance of microbiome. Again, if you found this video useful, please share it with somebody who may find it useful. Subscribe to my channel, like this video so I can produce more content like this, and continue to grow Youthful Medicine channel on YouTube. Thank you, and see you next time.